My former boss, Marvin Lindsay, who some of you may know or not, but one of the best people you're ever going to meet, was very intentional about making sure that he exposed me to the various areas of our business. Our industry is very nuanced. Not only do I have to deal with sort of the political climate in our state and even federally, of course, so those dynamics of working within the state government, working with other trades, other groups, other stakeholders, and working with state officials, state departments, because as I mentioned, our members are contracted with the state. So those relationships are extremely critical for our association. So really teaching me the ropes and really exposing me, and in one instance, threw me in the deep end.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Blanca Campos, CEO of the Community Behavioral Healthcare Association, or CBHA. Blanca, welcome to the show.
Thank you so much for having me, Joanna.
Blanca, tell us about CBHA.
Well, CBHA, the Community Behavioral Healthcare Association of Illinois. So we are one of the leading trade associations for safety net and mental health and substance use providers in the state of Illinois. And our members provide a full continuum of behavioral health services to children, youth, adults, and families in communities across our state.
Blanca, who are your members?
My members are community-based mental health and substance use providers across the state of Illinois. We have membership throughout the state of Illinois, and our members mainly work with Medicaid-eligible clients across the lifespan. So children, youth, adults, and families.
Blanca, do these agencies tend to be nonprofits? Are they private agencies? Tell us about that.
Our members are nonprofits, and they mainly contract with the state of Illinois to provide, again, services to Medicaid-eligible clients. They do take some commercial insurance, some of them, but the majority of the work that they do, and that's why they're considered community-based, they are certified by the Division of Mental Health here in the state of Illinois.
Blanca, is the need for your member services growing?
The need for mental health and substance use services has always been there. The need has been growing, and we saw a huge increase in the need for these services during COVID. Our members saw significant increases in their wait lists.
Oh.
Historically, because behavioral healthcare, and when I speak about behavioral healthcare, I mean both mental health and substance use, sort of that umbrella term that we use in our industry. So historically, it's a system that's been underfunded. There's been a lot of stigma around needing these types of services. I think what COVID did was reinforce sort of that idea that mental health is as important as our physical health. My association and our partners have always worked towards chipping away at that stigma, because we all have mental health, right? Some have severe mental illness and whatnot, but we all have mental health, and it is important that we take care of it as we do the rest of our body. But yes, the need has definitely increased. We've also seen that need increase very significantly for our youth, especially during COVID. So across the board, across all ages, but definitely across our child and adolescents.
Blanca, if the need is growing and your members have wait lists, are new agencies popping up, or are you encouraging the formation of new agencies? Like, how do we get out of this shortage? Sounds important.
So our association for years, even prior to COVID, we've been around for 52 years. Funding for behavioral health care has always been a priority for us. And that ties into sort of our members are limited in what they could offer, the services, or even the opportunity to expand because the funding hasn't been there. For the past 3 years, and especially this administration here in the city of Illinois with Governor Pritzker, there's been significant support in ensuring that we fund behavioral health care and that through that funding, we're able to increase services that are available in communities across the state. So yes, there is a need to increase services and yes, provider ties, but I think even just the current providers that we have, there's a huge need to ensure that they are reimbursed adequately so that they can in turn pay salaries that are competitive and they can compete with, as we talked about, like the hospital, they can compete with other community-based entities that focus solely on physical health, or that they can compete with private practice. So funding has always been extremely critical in terms of ensuring that services are available in the community and that current providers are able to expand services and access.
Well, Blanca, it sounds like there's a lot to talk about when it comes to what CBHA is doing, but let's turn to your journey. How did you get to become CEO of CBHA?
I think you hear this probably from the majority of folks you interview and a lot of association folks that we fell into it.
Oh, yes.
I fell into it as well.
Ah.
It's interesting because who talks about associations? I never heard about associations like growing up as an ideal or as a potential profession.
Right.
That wasn't anything that I was exposed to growing up. I think at some point I wanted to be a teacher. And I think even at a different point, I was like, okay, maybe when I was exposed a little more, I wanted to be an attorney. That's what you see, but you don't see folks in the association world. So ultimately ended up getting into the association world as I was finishing my graduate program and I started working for a political campaign. And after the candidate didn't win, he started an association for small business owners, and I grew up in a small business family. So that's how I started in the association world. And I just absolutely fell in love with advocacy. I'm an advocate at heart. I just absolutely love what I do. And through that job, I met my former boss. After 7 years, I started working for my current association, and it's going on 8 years at the end of this month.
So this is your first CEO job, it sounds like then.
Yes.
Tell us that story. How did you decide you were ready to take on the job and then apply for it?
It is my first CEO job. I was really lucky with my old boss, my former boss, my predecessor. He knew he was going to retire soon within the next few years. And so when he was looking to fill my position, which was a policy position, he was looking for someone that he could groom and mentor into taking over the association. And he met me. We actually had met through my old job, but we didn't make that. I literally applied through Indeed, I think, for this job. And then we're like, whoa, we know each other. So it just happened that I had already met him. What's so interesting, I really believe in fate and how things fall into place and how you're meant to be in certain places. When I was in my previous association, our state of Illinois went through like 3 years without a state budget, and a lot of people were impacted in a very sad and negative way. So we, at that time, put together a forum where we brought in folks from the business world, nonprofits, and coincidentally, my former boss was one of those panelists. And I remember thinking, gosh, I would love to work with him. He's such an amazing man, and I love the mission of his organization. And it so happened that I applied on Indeed and it was him, and I didn't make that connection. He didn't until we met in person. So that was really nice. And again, it was fated. I guess it was meant to do this and be here.
But Blanca, when he hired you, did he or you have a plan that you would be the successor at some point?
Yeah. So when he hired me, he knew he was going to retire eventually, and he was looking for succession planning and identifying a person who could potentially take over. Of course, at the end of the day, it's a board decision, but someone who he could groom and mentor into this role. So it happened to be me. He saw something in me, and I worked very closely with him for about 5 years. And then he retired, and I took over July 1st of 2022.
Blanca, it sounds like he really took you under his wing and mentored you. So what did that mentoring look like?
He did. He took me under his wing. My former boss, Marvin Lindsay, who some of you may know or not, but one of the best people you're ever going to meet, was very intentional about making sure that he exposed me to the various areas of our business. Our industry is very nuanced. Not only do I have to deal with sort of the political climate in our state and even federally, of course. So those dynamics of working within the state government, working with other trades, other groups, other stakeholders, and working with state officials, state departments, because as I mentioned, our members are contracted with the state. So those relationships are extremely critical for our association. So really teaching me the ropes and really exposing me. And in one instance, threw me in the deep end. This was early on when I started working at C, was probably year 2. And like I said, my industry is very nuanced. So I was a little nervous, but it was during the budget impasse. There was going to be a committee of the whole hearing. It means you have the House and the Senate hearing. I testified at that time on behalf of our members.
Wow.
So he did things like that to sort of expose me, like, this is what you're going to be doing. And I remember at that time, I was so nervous. I was like, oh my gosh, like, this is so new to me. I'm very glad he did things like that because I've always been a doer in my association, in my previous associations and my work in general. I'm the doer, I'm the behind the scenes person, and I'm not the face. And I wasn't necessarily comfortable. Like, I'm like, I don't want to be in front of people. I just want to do my job and do it well and I'll produce because I always get things done.
Yeah.
So he started making sure that I grew in that area because I needed to grow in that area. So yeah, he did that and he did everything he could to expose me to what my role was going to look like after he left.
Yeah, and here you are. Well, that is just lovely. So let's turn to CBHA. You've got an annual conference coming up in a couple weeks. Tell us about it. What's new?
So we're very excited. Our conference is our 52nd annual conference. We have members coming from across the state. We used to hold our conference in Schaumburg. We outgrew that space last year.
Oh, congratulations.
Thank you so much. It's actually very exciting in terms of just attendance, in terms of exhibitors. So we're at a much bigger place out in Oak Brook. So very excited about that. Seeing people in person, being able to collaborate and have in-person conversations about everything that is happening in our industry. We have state elected officials. We have folks from the various relevant state departments that our members work with join us at this conference. And then a lot of just really dynamic speakers around, as you all know, and I think all associations can relate to this, around what's happening around AI. For our purposes, everything behavioral healthcare, there's a lot of change that is happening, positive change. We're building out our state's crisis system. So there's going to be a session around that. There's a lot of changes federally around the substance use rules and confidentiality. So we'll have sessions around that. There's a new model for providing behavioral health services called Certified Behavioral Health Clinics, CBHCs. Very excited about that model because as we're talking about sustainability and expansion of behavioral health services across the state and across the nation, this model is a more sustainable model than what we're currently working in, which is a fee-for-service model. So very excited to have folks come in and speak about where we're at as a state around that and the opportunities for expansion of that specific entity type in Illinois.
Blanca, it sounds like it's a very dynamic environment that you're operating in with lots of changes and legislation and regulation. And that's maybe fueling why people want to come to the conference. But are there other things that you've done to the structure of the conference? Because you're growing, and usually that doesn't just happen by accident. Like, you're doing things right.
We've been very intentional about making sure, first of all, that there's an awareness about the conference, making sure that we can not only create opportunities for community-based mental health providers, but also broader stakeholders that we work with. So sessions that can be tailored a little more broadly. So I think a lot of that, and I think we have a very supportive membership base. We have very supportive partners. And then again, as we've been talking about, sort of the need for behavioral health care has been increasing. So in terms of sponsorships, in terms of vendors, we are seeing that support come in through those channels as well. So I think all of that together has made our conference grow. Again, going back to that awareness about the importance of behavioral health care. I think a lot of organizations and individuals really want to get more involved in, like, what does this look like for my community? What is happening in the industry? How can I support the work that is happening? So I think all of those things have helped increase sort of our exposure and our attendance.
Well, if I visit your website, advocacy is very prominent in the work that you do. What types of issues do you advocate on?
Historically, we've been advocating for funding. That is foundational. When you can't expand services, you can't recruit and retain your workforce without appropriate reimbursement. And for a really long time, our Medicaid reimbursement rates have been extremely low. Some of the lowest probably in the country, but definitely extremely low to where our members were not. It's very hard to compete with other entities. It's hard to compete, as I mentioned, with private practice. So funding has always been very, very, and still is a critical part of our advocacy. I think we are seeing as an industry, and not just in Illinois, but across the nation, shortages of behavioral health workforce. So that's been another thing that we've been pushing for a really long time. We know that in part, it is a symptom of an underfunded system. And also the stigma, right, that surrounds these mental health and substance use issues. So I think chipping away at that advocacy wise with the legislature, with creating awareness about sort of, again, mental health is as important as physical health. A lot of our advocacy has focused around that. So funding, ensuring that we have a robust workforce and supporting them in any way we can. We passed legislation a few years ago that created the Behavioral Health Workforce Center of Illinois. It was modeled after a center out of Nebraska. Their whole mission is to ensure that they work towards creating a more robust workforce, and that involves opportunities around training, opportunities around mentorship. So a pretty comprehensive way of dealing with recruitment and retention of the workforce, creating that awareness with young people that this is a career option. Being a therapist, I work with a lot of therapists and it's so amazing. So if you're not exposed to it, you don't know that that career opportunity is out there, then, you're not, this is not, people don't go into the field. And also ensuring that when you do go into a field, if this is a career that you choose, that you are adequately, you're paid fairly. You're paid a wage where you could thrive and build a family if that's what you choose to do. So that's also very important. Again, ties back to sort of that funding piece. Also around rules and regulations, that's a big piece. We're a heavily, heavily regulated industry. It does create a lot of different challenges in terms of burnout for clinicians because they spend a lot of time, with documentation and paperwork. It also creates access issues because that time that they're spending doing all of that, they're not seeing clients. We call them clients, not patients. Yeah, so those have been advocacy-wise our main key areas.
Well, Blanca, pretty much every trade association that I work with has some type of advocacy function, and it's always a challenge to get the members involved. How do you get your members involved?
Our members are extremely involved in our advocacy efforts. Every piece of legislation we've ever written was to address a gap that our members have identified or a challenge that our members have identified. So they are very engaged. And as I mentioned, because they contract with the state, what happens at the state and in Springfield, our state capital, is it really does impact like their everyday, like the services they're able to offer. It impacts their workforce. It impacts so many things. So they are very privy to what is happening. And we're also very good about making sure that we provide updates around what's happening around the budget, what's happening around different policy proposals. And again, we're very proactive about having a legislative agenda every single year and working with champions in the legislature to address the needs of our members. So again, I think because of the nature of the work that they do, there is an inherent interest in being engaged in advocacy and a passion too. Let me tell you, our members are amazing. I mean, they work with our most vulnerable people who sometimes, unfortunately, you see on the street who are unhoused, and a lot of people are even scared. Our members have the best hearts. Those are the people that they work with, right? There's a heart, and there's also, because what happens in Springfield impacts them directly so much, they're aware and privy and engaged in advocacy.
Well, that's amazing, and every trade association's dream. Blanca, You've identified that mental health is really important, and we hopefully now recognize that mental health is just as important as physical health. What do you think our role is as leaders in making sure that we are really supporting good mental health for our staff?
I think leading by example is so important. Sometimes I tell my team, I need a mental health break.
Ah,
And I'm okay with saying that. I need a mental health break, whether that's half an hour, that's an hour. I need to take a walk. I take my vacation. I encourage my teams to take vacation because if we are not good, like we can't help our members.
yes.
What is that saying? You can't give from an empty cup. And the fact that we work in behavioral health care, there's so much grace. There's so much grace from members. There's so much grace for each other in our team that when someone needs a little bit of time, we'll fill in for whomever. But I think as a leader, specifically me, leading by example, and if any of my team members come to me and say, hey, I need this to take care of my mental health, I encourage it. Yes, please take it. Please take it. Lead by example and be supportive. In my industry, I work in behavioral healthcare, so it's a little easier for my team to share sort of those vulnerabilities or private. People feel, how they feel. And I don't know that it's necessarily across the board. So just creating a safe space for people to feel okay talking about it with whomever, right?
Yeah.
And some people still may never feel comfortable talking about it, but you as whether association leader, a manager or whatnot, if you can create that safe space for someone to come to you and share, not necessarily have to share everything, but share like, hey, I need this for my mental health, and you supporting them in that moment, I think that means a lot.
Yeah, I agree. Well, Blanca, we are approaching the holidays, and I read someplace that mental health issues spike during the holidays, which is really pretty tragic if you think about it. It's supposed to be the most wonderful time of the year, and yet mental health issues spike. So what's one thing that we as leaders can do to help our staff and our families navigate this time?
Yeah. We always think it's a time of cheer, and it is a time of cheer for a lot of people, but it's also a time of grief for a lot of people, for when people have lost folks, people who have had to, for whatever reason, or even for their own mental health, have had to cut people out of their lives. So yeah, I think checking in on people is so important during the holidays, and not assuming that it is a happy time for everyone, and really giving people, again, going back to grace. If you get anything out of this session with me, I would really hope that it is give yourself grace and give others grace during the holidays and always, because we don't know what other people are going through. And as leaders, especially, we are juggling so much. We juggle so much and we put so much pressure on ourselves. And sometimes we're so hard on ourselves. But I think the grace that we give to others, or, hopefully give to others, like we also give to ourselves. And that's for help. I mean, I'm okay with asking for help if I need it. Check in on folks. If people want to talk about it, just listen. Sometimes people just want someone to listen to them and not necessarily want advice. And it's okay. Just being able to sit there with someone and hearing them out, I think it goes a long way during the holidays and always, but especially during the holidays.
Yeah. Well, Blanca, terrific advice. Give yourself grace and give grace to others and check in on them. This has been a wonderful interview. I want to thank you for everything that you're doing and for everything that your members are doing. I hope that you'll come back in the future and tell us about all the amazing things that you're doing, as well as give us an update on the state of mental health in our country. Thank you.
Yes. Thank you so much for having me, Joanna. It's been a pleasure. And I really do hope that folks lean into sort of that grace for yourself and checking in on your loved ones, especially during the holidays. But like I said, sometimes you see people and they appear so strong, and we all need that little, hey, how are you doing? How are you feeling? It's okay. That's what we're here for, to help each other out.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!